So the first exercise we talk about is decongesting the nose. And it's very, very easy to decongest the nose. You know, usually the treatment for nasal congestion is the person goes to their pharmacist or their drugstore and they get nasal decongestants, or then they may go to their doctor to get nasal steroids, you know, and if it persists they may end up even having an operation. Whereas I've used this with thousands of people and only about 10-12 people was I not able to restore nose breathing. Now it works, and even if there's a slight deviated septum it still works. If there's small nasal polyps we can shrink the polyps. If the polyps are very big it's difficult. The individual does have to go to their ear, nose and throat specialist. The exercise to decongest the nose: gently breathe in through your nose, breathe out through your nose, pinch your nose, nod your head up and down while you hold your breath. Hold your breath for a long period of time until you feel a strong air shortage. Release your nose and resume breathing through your nose and bring your breathing volume down towards normal. Wait about a minute and then repeat again. So basically you hold your breath to establish a strong air shortage, release your nose, calm your breathing, wait a minute and repeat again, and repeat 6 times. This will take about 5 minutes, and at the end of the 5 minutes your nose will be temporarily decongested. In order to get a more permanent decongestion of the nose, we need to increase the control pause, and for children we need to increase their steps. However, this is always the first exercise I use with people, and bear in mind that not everybody can be doing this. For example, a group of people with high blood pressure, type 1 diabetes, people with cardiovascular issues, other cardiovascular issues, etc. Be careful doing this exercise. You're better off going easier. If in doubt, go easy with the exercises, you know, because it can be a little bit intense if you're holding your breath for as long as possible. It's safe for the vast majority of people, but it's quite a powerful exercise. So for a certain category of people, we don't want to overdo it. The nose is not just the 2 holes in the face. For example, here's an anatomical model of the nose. And I'd like you to do this. I'd like you to put your tongue up into the roof of your mouth like this. And I'd like you to drag your tongue all the way along the hard palate until you reach the soft palate. So you get a sense of the size of the nasal cavity because the floor of your nose is the roof of the mouth, and nature doesn't waste space. So inside the nasal cavity are turbinates, but also there's a gas released into the nasal cavity called nitric oxide. Moisture. When you breathe through your nose you carry moisture. The incoming air picks up moisture, and you've got this moisture-laden air arriving to the lungs. And gas exchange, oxygen transfer from the lungs to the blood take place in the presence of moisture. Nasal breathing has been estimated to improve arterial oxygen uptake by between 10 and 20%. So not only do people who breathe through their nose, not only do they get a better oxygen uptake, but they also have better oxygen delivery to the cells due to carbon dioxide, as I spoke about earlier. And another factor is, of course, nitric oxide. Nitric oxide is a wonderful gas. In 1992, the journal Science said it was molecule of the year. So it plays a role in many functions in the human body, including opening up the blood vessels, reversing cholesterol, reversing the buildup of plaque, plays a role in neurotransmission, and how the brain cells communicate with each other, and also in homeostasis. The key is, Catherine, to breathe gently, softly and slowly through the nose. And by that we have to optimize our oxygen uptake. Now before we go, what I'd like to do is I'll show you an exercise to unblock your nose. It's very, very simple. We're not exactly sure how this works. However, we know it works. So it's probably based on the premise of nitric oxide, that when you breathe in through your nose and breathe out through your nose and pinch your nose, after you pinch your nose, nitric oxide pools in the nasal cavity, and it's probably nitric oxide that's helping to decongest the nose. So I'd like you to do this exercise as follows. Take a small breath in through your nose, small breath out through your nose, pinch your nose, and now gently nod your head up and down as you hold your breath, and hold your breath until you feel a fairly strong need for air. Continue holding your breath, continue holding your breath. When you feel a fairly strong need for air, let go of your nose, breathe through your nose and calm your breathing immediately. Excellent, and calm your breathing immediately. And then we wait for about a minute or so. Now that nose unblocking exercise will also work during a head cold. And because oftentimes the risk is that if we have a head cold, the nose is stuffy, so therefore we breathe through the mouth and then we're taking, you know, unfiltered cold dry air into the airways, and it's going to lead to, for some people, inflammation of the airways, both the upper and the lower. Say people who are prone to asthma, for example. You know, many asthmatics, they have rhinitis of the nose, so their nose is stuffed. And it's crucial that we learn to breathe through the nose. Not only does nasal breathing have to sterilise the incoming air, but if we have a stuffed nose, it adversely affects our sleep. People with blocked nose don't sleep very well. They're tired, they're often holding their breath, and they wake up exhausted. They often need to get up to go to the bathroom during the middle of the night. And there's other aspects. They wake up with a dry mouth, stuffed nose, and if they've asthma, they may be wheezing or coughing. So it's crucial to breathe through the nose at all times. So let's try it again. Take a small breath in through your nose, small breath out through your nose, hold your nose, and as you hold your breath, gently nod your head up and down, and hold your breath for as long as you can. To unblock the nose, you need to hold the breath for as long as you can. To unblock the nose, you need to hold. So keep going, keep going. You may feel your diaphragm spasm, relax into your body, and when you really feel the need to breathe, let go, breathe through your nose and calm your breathing. Excellent. So now we wait a minute. So we do it about 5 times. Your nose should be free, certainly after the 5th time. And you might even find that it gets freer a little bit before that. And one way to determine if your nose is open or closed is just basically block one nostril and breathe through it, and then block the other nostril and breathe through it. If you'd like to try it there, you'll get a sense of which nostril is more open or closed, or if there's a change in your nostrils as well. So after about a minute, we do it again. And initially, if you feel a little bit lightheaded, it's only initial, don't worry about it. You know, just go with the next breath, hold a little bit less. So again, take a small breath in through your nose, small breath out through your nose, pinch your nose with your fingers, and gently nod your head up and down. At the same time, hold your breath, and keep holding your breath until you feel a strong need for air, a strong hunger for air. When you feel a strong hunger for air, let go, breathe through your nose, and calm your breathing immediately. Excellent. So as you're holding your breath, you can imagine that nitric oxide is pooling in the nasal cavity, and it's nitric oxide that's helping to do the work of decongesting the nose. Now, that's only a temporary measure. At the same time, it will help to decongest the nose. But when you change your breathing down towards normal, the nose then remains decongested. And even if there's pollen outside, you know, if there's various triggers that usually, if it's allergic rhinitis, various triggers that cause nasal congestion, we can still address it. By using that exercise to temporarily help it, and also by using the remaining exercise to permanently change breathing, to reset the respiratory centre in the brain so that breathing volume comes down towards normal, and with a normal breathing volume, the nose remains decongested. Okay, so we'll try it again. Take a small breath in through your nose, small breath out through your nose, pinch your nose, and gently nod your head up and down, and hold your breath for as long as you can. Hold your breath for as long as you can. And when you feel a relatively strong need for air, let go, breathe through your nose, and calm your breathing. And we'll try it in one more time. So when we look at, you know, human beings, infants are innate nasal breathers. We were born as a nose breather, and we had our mouths closed for the first 5-6 months of life. And it seems to be during when we first get our first teeth that we get nasal, we get an upper respiratory tract infection, we get, you know, nasal congestion. And the infant at the very start, they continue trying to breathe through their nose, but they feel stuffy. And eventually then they understand then to switch to open the mouth. And that seems to be the very start of it. So as human beings, we were born breathing through our nose, and also the vast majority, pretty much all animals are innate nasal breathers. You know, when I was looking through the research, which animals breathe through their nose, which animals breathe through their mouth, I could actually only find 3 diving birds, 3 animals which are mouth breathers. They can breathe through their mouths, and that's including gannets, pelicans and penguins. And the vast majority of other animals, including dogs, are innate nasal breathers. So interesting, if you look at a horse, always the mouth is closed. A cat, mouth is closed. And it's only if a farm animal is sick that they revert to mouth breathing. So if we see an animal breathing through the mouth, it's not a good sign. And half of human beings in the Western world have a habit of habitually breathing through the mouth. Okay, can we try that once more?
Yeah.
So take a small breath in through your nose, a small breath out, hold your nose, and gently nod your head up and down for as long as you can, and I need you to hold your breath for as long as possible. Hold your breath for as long as possible. So continue holding your breath, continue holding your breath, continue holding your breath, continue holding your breath. When you feel a strong air shortage, let go and continue relaxing into your body. When you feel a strong air shortage, let go, breathe through your nose, and then calm your breathing. Excellent. And that's how you decongest the nose. Now, that exercise will also help if we're feeling a little bit fatigued. And also, say, for somebody with constipation, they hold their breath for as long as they can, and it relieves constipation. So that breath hold is very, very useful for that exercise. You know, literally decongesting the nose in five minutes or so. And even if somebody, you know, if for example they have a deviated septum, which many people do, I have a deviated septum, but I can still breathe through my nose. You know, with a deviated septum, the vast majority of people can still breathe through their nose. And the rule of thumb that I use is, if you can breathe through your nose for 1 minute, you can do it for life. So you've had your mouth closed for more than 1 minute, so you can breathe through your nose for life.